There's a study that is out there discussing how anger could actually increase the risk of heart disease. Now, I know you've heard over and over throughout life, you've heard people say, no, don't get them mad, you give them a heart attack, or don't scare people, you get them a heart attack, right? That is a colloquialism, I think, in many ways. But I want you to hear a clip from Good Morning America that gives some of the details of this study. Check this out.
It's a fascinating study because we've long known that anger has been associated with problems with our heart. But in this study, they were actually to gather participants, almost 300, and they were able to subject them to different emotional experiences. And what they found that anger was most likely associated with the malfunctioning of specific blood cells or epithelial cells. And that's important because that can lead to hardening of the blood vessels over time, and then that can lead to increased risk of heart attacks, strokes, and cardiovascular disease.
Now, I don't even know what an epithelial cell is, right? I'm pretty sure I could spell it if I tried. But somebody that knows what is going on here is board-certified invasive cardiologist Dr. Fahmi Farah. And she's been on with us before and is the director of Global Healthline Foundation. Dr. Farah, welcome back.
Thank you for having me. It's always a pleasure to be on your show.
Thank you. Likewise. It's good to have you. So let's talk about this. And again, I feel like it's kind of goes without saying that if you're always angry, you're going to pop a gasket. But tell us what is so significant about this new study that shows how anger could, in fact, increase your risk of heart disease.
Yes. We've long known, of course, that anger is not a good thing. And this study just further reiterates that thought that we had already known. And along with anger comes several negative impact on the body, particularly your heart. When we're angry, our body releases several types of stress hormones that can have negative impact. So, at a microscopic level and at a macroscopic level. So microscopic, like something you mentioned, like, the endothelium and the epithelium, which are like internal structures of our blood vessels, those can get impacted, like, they feel that effect and can get damaged. And in the acute setting, of course, we feel our heart racing, so your heart rate will go up, and blood pressure goes up. And those can have serious impact on your cardiovascular health.
That doesn't sound good. This doesn't sound good at all, Doc. Now, what is it that is recommended? Because, I mean, some people, like I live in the New York metro area, anger is a pretty normal thing around here. People are just constantly yelling at each other. What do you recommend? Moving, more exercise? What's the secret here?
Yes, I think, finding out the triggers, what is it that causes you to get angry? So finding out those triggers and avoidance, of course, is the key so that you don't get anger. And just mitigating those things, like just, make sure that you relax and practice some relaxation techniques like doing yoga, taking your mind off. If there are certain triggers that that can create that kind of a scenario, just remove yourself from that place or that person for a little while, gain control of yourself, and then have a conversation. So these are the types of like non-medicinal things that you can incorporate in your life to de-stress, relax, and not get angry.
Yeah. Well, listen, I'll take your word for it. I think it's easier said than done. But what's interesting, and again, this is according to the Journal of the American Heart Association, that feeling angry for as little as 8 minutes a day could raise your chances of experiencing a cardiac event. Now, I think that's very significant, Doc, because many people, if you're sitting in traffic and, you're palming your face and you're clenching your steering wheel and you're yelling at every last guy that passes by you or they're yelling at you, I think that could be well over 8 minutes. And thinking that if you have to go to work and then come back, most people have a commute. I think the average commute is 26 minutes. This sounds like really, really bad news. I'm thinking people need to find a way to relax, especially when they're in the car, no?
I completely agree with you. Relaxation is the key, and like very significant. As little as 8 minutes can have huge impact on your body. And again, it all goes back to what it does, internally. That high blood pressure, when we're angry, without a doubt, our blood pressure goes up. And high blood pressure is one of the key ingredients to creating or causing cardiovascular disease. Also stroke, like stroke is a major problem, and anger can cause that. So I think, people need to find remedies, and for those who are stuck in traffic and getting angry, just like listen to an audiobook or your favorite music. Those outlets are so important to make sure that you're not getting overly angry and excited.
Folks, we're on with Dr. Fahmi Farah, cardiologist, board certified invasive cardiologist. And we're going to continue this discussion on heart health when we come back. Don't go anywhere. All right, America, welcome back, amigos. We continue our discussion on how anger can kill you. And listen to this number, right? On average, someone dies of cardiovascular disease every 34 seconds. Every 34 seconds, somebody's dropping dead from cardiovascular disease. I didn't know that. I would never even imagine that what the number's like. You're talking about something like 2,000 deaths per day from cardiovascular disease, heart attack or stroke. Our guest is Dr. Fahmi Farah. She is an invasive cardiologist. And Dr. Farah, I want you to tell us a little bit about how this is shaping up, because oftentimes when I do these segments on medical stuff, we're talking about Ozempic, or we're talking about obesity and addictions to food. And I know all of that stuff, and diabetes and all of that also contributes to cardiovascular disease. So what is the current state of affairs in America as you see it? Are we doing better or worse with cardiovascular disease?
Unfortunately, I do think that we're doing worse when it comes to cardiovascular disease, especially post-pandemic. There's been a surge of, in the field of cardiovascular disease. We're seeing a definite increase in the rate of heart attack, even in the young population. We recently, post-pandemic, there was a study that looked at more than 1 million people, and we saw an increase, as much as 40% increase in the rate of heart attack in young population between the age group 25 to 43. So for sure, to answer your question, we do see a worsening when it comes to cardiovascular disease.
And that's an alarming thing to talk about. But recently there was some news that came out of a lawsuit regarding AstraZeneca and the COVID vaccine that they released that was causing blood clots, and it was causing a disproportionate amount of deaths and other type of cardiovascular injuries to those that had taken that vaccine. What percentage, based on your understanding of it, of what you're describing, is tied to something like that?
It's hard to say. Based on the statistics we've had, I don't think the vaccine itself is responsible for a lot of it, although there were some cases that were reported. But the vast majority, I think the virus itself was the culprit. Right.
It causes this, I guess, like a long-term side effect, or that's kind of the mark that it leaves on people, is it ruins the... How does that happen, with something that seems to be primarily respiratory?
Right. So we've known for a very long time that any kind of viral illness can trigger cardiovascular issues. For instance, like the flu season, for example, the flu's been around for a very long time. And the flu, that viral infection can trigger heart attack because it can destabilize an already preformed blockage that's been there for some time, and it can rupture that plaque from the strain of the viral infection, and the rate of heart attack can increase. So we already knew that from other types of virus that we've dealt with in the past, but COVID has accelerated that from our understanding, and statistically speaking, not just in the realm of heart attack, but the entire vascular system in general can be affected by COVID. It can be destabilized, and the endothelium, which are the linings of the vascular, our blood vessels, can be weakened. So COVID, it's still something we're still figuring out. It's fairly new, but from the data we have, it can attack the cardiovascular system for a multitude of different ways.
And, something I find interesting is, and again, I didn't grow up hearing that being fat would kill you. I grew up hearing that eating the wrong thing would kill you, and that being fat was you were big boned or this or that. And here I am, later on in life, I had become overweight. I was 270 pounds at one point, and I finally found a doctor that was honest enough to tell me, he said, "You're going to drop dead." And I was like, "Get out." And he was like, "No, really." And it was a big wake-up call for me, and I've lost those 70 pounds, and I'm just under 200 pounds now, which is not ideal still. He always tells me you need to drop another 20. But I've lost some weight, and I've changed my lifestyle in many ways. But I realize now the impact that this has, and it's all cardiovascular, right? That's ultimately what kills you. It's not anything else but the heart attack or the stroke that gets you from the way you eat, from the way you don't exercise, from so many things that we have in our lifestyle. Do you think that we still have a problem, in America at least, of people being drastically overweight?
Oh, absolutely, we do. It's one of our biggest issues here in America. Like, obesity is a huge issue. It's something we all need to raise awareness with. You raised a very, very good point. You said, the way we phrase it in our communities, in our culture, we're very sensitive, to the topic of obesity. And in my opinion, we shouldn't be. We should be very upfront, just like your doctor did.
Yeah.
That there's, as your physician, it's our duty to be upfront and honest and transparent with you that no, just because you don't have that blockage yet, it doesn't mean you're healthy. If there's obesity in the picture, you are unhealthy by definition, and your mortality rate is higher by definition. So don't let anybody fool you by telling you that, oh, you're obese, it's okay, you're healthy, you're not. So losing that weight is imperative to heart-healthy lifestyle.
Yeah, listen, I'm on board with that one. And I only bring that up because when I'm not on the radio, sometimes I go on TV and I'll debate different current events topics. And one time I was in the green room at a TV station, and my opponent in the segment we were doing was a really nice guy, and he was telling me about how he served on the board of a foundation and gave a speech and opened up with the phrase, "Fat kills," and he followed up with saying, "Fat is bad." And he got booed by the organization and everybody there. And I thought, why would that happen? And I had this different understanding because my doctor had, kind of schooled me on it and told me, listen, you're going to drop dead. He told me you're going to have a massive heart attack or stroke by 50 is what he said. And he was very clear, and he wasn't making jokes about it. And I thought, why would you do that? And this guy said, well, they were concerned that there were women in the audience, that they felt I was fat shaming certain people. We didn't want to body shame people. And I thought, body shame? They're going to be dead, is what I was thinking. And it strikes me as crazy. Where is this coming from, Doc?
It's the culture. I think a lot of our, it's the image, like in society, if somebody's obese, they face certain stereotypes, they're not accepted, and they just have a lot of body shaming because we put, like magazines, like social media now, media in general, they tend to promote a certain type of body type, right? Like models, that's what everybody thinks is the ideal body type. And I think that puts a lot of strain and a lot of pressure on people's image, and it's detrimental in many different ways. And this is one prime example that, obesity is not something that people should be, it's not a body shaming a thing. It's something far beyond that. It's not about the image. It's about your health. And as you said very plainly, and I like that you're going to drop dead. So it's not something that at all should be on a social spectrum. Like, it's not at all that should be labeled as stereotype of any kind. It's one fact and one fact only, and that is your health. That obesity means there's some amount of unhealthiness that you can improve, and you can have a much healthier lifestyle. The quality of life will improve, and certainly it has survival benefit.
Sure. And you know, Doc, I think you're very kind, and you're being very generous in your response. But I would say I think the approach, I'd had several doctors in my adult life, and it wasn't until I got this one that literally told me the way he did. And that was something that worked for me. But I can tell you, I think there's a lot of people out there that still say the stuff that I heard when I was a kid. Oh, they're just really thick, or they're just big boned. And not realizing this really thick thing is going to cut 20 or 30 years off of your life. This really big bone thing is going to be a guaranteed trip to pre-diabetes or diabetes in your 40s and 50s, or maybe your 60s. And that ultimately, your eyeballs are going to bleed. I have a friend who gets shots in his eyes every month because that's what he has to do because of the bleeding in his eyeballs because of cardiovascular disease. And I think people don't know about it. It's funny how we know about everything else in the world, and we don't know about how bad everything is for us. And I think there's a political part of this, right? There's food companies, there's drug companies, there's a lot of competing interests. But ultimately, I think, you know, when a doctor comes on a program here like you are, and I'm grateful that you're here, I want every doctor anywhere to be as plain spoken as they can be, because I think people need to hear the message that if you're not healthy, you're going to die. And I think that gets overshadowed by, you know, don't say they're fat, don't say they're this, don't say that. No, you're fat and you're not well. And in so many situations, we see fat people, obese people, morbidly obese people, and the reason they're fat is because they've had either some major trauma and they're eating their feelings, so to speak, or they have a very serious problem with food. So I want to get your reaction to that when we come back. Don't go anywhere. We're coming right back with Dr. Fahmi Farah. So we're afraid to tell people that they're morbidly obese. We're afraid to say that fat kills and fat is bad. Dr. Fahmi Farah, is our guest. Doc, what say you?
I am going to be very direct that, you know, obesity is one of the major risk factors for cardiovascular disease. It increases your risk of heart attack and stroke, and as a result, it decreases your survival rate. So I believe that as a society, we need to get away from the culture of body shaming and stereotyping that are associated with obesity and become real and have real conversations and educate our public on how to reduce obesity and get down to the bottom of why is there such an epidemic of obesity here in the United States. What is the food relationship? You know, what kind of foods are we consuming? That's one. But also, like, getting into other things, like is there mental health issues involved? A lot of times obesity can have mental health along with it, like you know, depression and things like that. So I think we need to work together to reduce obesity.
Dr. Fahmi Farah, you are a gentlewoman, a scholar, and a patriot. Thank you for being with us. I appreciate it.
Thank you.